Hi everyone, my name is Prakash and I'm a third year medical student. Along with two more of my colleagues and as part of the Delta Teaching series, I'm going to talk about the WHO Surgical Safety Checklist. It's a tool designed to make surgery safer worldwide. Surgery can save lives, but it's not without risks. Complications like infections, bleeding, or wrong site surgery still occur, and many of these mistakes are preventable. And that's why in 2009, the World Health Organization introduced this checklist. It's now used in hospitals globally to improve communication and to standardize safety checks and reduce surgical harm. The checklist is simple but powerful. It's divided into three key phases based on the timing in the operating theatre. Sign in, which occurs before the anesthetic is given. Time out, just before the skin incision. Sign out, before the patient leaves the operating room. Each phase is a moment for the team to pause and check vital safety information, and we'll go through each phase in a moment. The first phase, like we mentioned before, is sign in. This happens before the patient is anesthetized. Here, the team confirms the patient's identity, procedure, and surgical site. They also check that consent form is signed, if the patient has allergies, the anesthetic machine is working, and if the patient is at risk of bleeding or aspiration. It's a chance to prevent errors before they even start. Next, the second phase is time out, and this occurs just before the first incision is made, and this is the most team-based part of the checklist. The entire team is present during this phase, for example the surgeon, the anaesthetist, nurses. They introduce themselves by name and role and confirm the patient, the procedure, and site again. The team also discusses whether antibiotics have been given, any expected complications, equipment concerns. This step improves communication and helps catch potential problems early. The final phase is sign out, and it's done before the patient leaves the theatre. The scrub nurse will confirm what procedure was performed, that swabs, needles, and instruments are all accounted for, and that any specimens are labeled correctly. The team also discusses the recovery plan and any concerns. This phase ensures safe handover to recovery or the ward team. So, does it work? Yes, and the data is strong. Studies show the checklist reduces surgical infections, post-operative complications, and death. And it works not just in big teaching hospitals, but also in smaller or resource-limited settings around the world. Now remember, the checklist isn't just about ticking boxes. It's about changing the culture. It encourages better communication, clear role definitions, and teamwork across the disciplines. Importantly, it empowers all members of the surgical team, even the most junior, to speak up if something doesn't seem right. But despite its benefits, the checklist isn't always used properly. Sometimes it's rushed, treated as a formality, or ignored entirely. The hierarchy in theatre can be a problem too, and junior staff may not seem or feel confident speaking up. That's why it's important to promote a culture of safety where everyone's voice is heard. And the final slide, to summarize. The WHO Surgical Safety Checklist improves outcomes and saves lives. It has three key phases: the sign-in, the time-out, and sign-out. It ensures safety, promotes communication, and prevents avoidable harm. But it only works if we take it seriously and embed it into our surgical culture. Thank you for listening, everyone.